in time, I'd like to intervene and introduce the next speaker, and that is Claudia Silva. Claudia, I'm really pleased that she's here today. She is a nurse, a practicing nurse in Portugal at the Litoral Alentejano Local Health Unit. I hope I pronounced that properly and not doing any injustice to my Portuguese accent. She is also auditor of the Department of Quality in Health in Portugal, so she's quite influential in lots of ways, and has bravely taken on the PhD journey that many of us have done and struggled with, and come out successfully and totally transformed at the end of it. So we're really supporting her in doing that, and that will be at the University of Lisbon, where she's going to be looking at person-centeredness and person-centered interventions, and particularly in a focus on the recovery from cardiac conditions. And what she's going to do today is present her initial piece of work, and we're really looking forward to hearing that. So it's over to you, Claudia.
Okay, thank you, Sean, for your presentation. Okay. So once again, Sean, thank you for your presentation, your kind presentation. So I am Claudia. I'm on the first steps of a PhD program. In the next few minutes, I'm going to talk to you about the effectiveness of person-centered care intervention on persons' self-efficacy following an acute coronary syndrome. And this reports to a systematic review that was conducted by me, by Eva Carlson, Paulo Nogueira, and Adriana Henriques. Okay, the person's experience when suffering an acute coronary syndrome involves the feelings of sudden feelings of that are life-threatening, and that leads to fear, to anxiety, that affects recovery and return to previous life from that event. And it's often reported that there is a disruption with the self before the acute coronary syndrome. So in this data is stood out and is highlighted by the high prevalence rates of unhealthy years. We know that in Europe, 23% of all unhealthy life years lived are due to cardiovascular diseases, and half of those are specifically due to ischemic heart disease. So the perception, the person's perception, the experience, and how those emotion reactions, how those symptoms affect his, her life is unique knowledge that is really important for the recovery process. The fact is that evidence shows us a gap that Tanya spoke in the beginning. There is a gap on how care is delivered in clinical practice and individual needs and preferences. So this highlights the need for innovative interventions that can incorporate the person's needs and preferences on the recovery goals. And this is important because the recovery process happens not only at the clinical level, but also at the personal level. A sustainable recovery requires that the person takes responsibility for her own care, that she continues living with that feeling of loss, but also with renewed purposes. So this approach connects directly to the self-efficacy, which understood as the belief in one's ability to perform given tasks, that on the belief that she can influence the events that affect her life. So it's the self-efficacy that will determine whether those tasks will be performed, the amount of effort that she will put into it, and for how long it will be sustainable in faces of barriers. So the perception of these cardiac symptoms can be assessed by the narrative, by the person's reported outcomes. And the comprehensive perspective of her situation, the understanding of the person's situation, and as well as the participation in the decision-making are really a central component of a person-centered practice. So it considers the 5 ways of being that Tanya talked to us from the beginning, and highlights the health and the resources, and not only the limitations and the disease. So this was the starting point of this systematic review. We wanted to know if person-centered care interventions, compared to usual care, were effective in enhancing self-efficacy after an acute coronary syndrome. So in order to answer to that question, we established this aim, which was to describe the effectiveness of person-centered care interventions, aiming to enhance self-efficacy after an acute coronary syndrome. So we conducted a systematic review of interventions with meta-analysis and search for studies in Cochrane, Medline, CINAHL, Web of Science, and Scopus. Studies published between 2012 and 2022. And we included person-centered care interventions that had that aim to enhance self-efficacy. We didn't set any limit to the follow-up length or the way it was going to be delivered. We considered only adult samples more than 80 years old with any type of acute coronary syndrome, and we considered only randomized controlled trials with parallel groups. We excluded duplicate studies, children's sample, if the study was not studying the self-efficacy, or if the intervention was not stated as underpinned in person-centered concepts. And we considered the description, the definition by McCormack and McCance. So after applying these criteria, we start with 46 records and end up including 6 studies, and 2 of those included in the meta-analysis. We checked for quality, applying the risk of bias tool by Cochrane. And we come up with some concerns in the overall bias that were due to the measurement of the outcome, because there was no, because of the non-concealment of the outcome assessors, although the studies were based on the person's reported outcomes, so all participants were aware of the care that was going to be provided to them. So we included those 6 studies that were conducted in Sweden and Ireland. They involved 314 participants that was hospitalized because of an acute coronary syndrome, with the average age of 60 years old, and the female participation was in average of 42%. The person-centered care interventions had that aim, of course, to promote self-efficacy in this situation, and were delivered by registered nurses and or physicians. They were delivered face-to-face and or at distance, and it could include also in-person sessions. They started during hospital stay and had a follow-up that ranged from 1 month until 24 months. There are some similarities that we would like to highlight, and they are related to the person's narrative. And in all interventions, the person's narrative was assessed and was incorporated in the health plan. And that health plan was documented in a written form, and it was made accessible to the person. As differences, we highlight the previous training in person-centered care ethics to the healthcare professionals that was not present in all interventions. So as outcome measures, we identified studies with general self-efficacy and cardiac self-efficacy, which is an outcome specific for cardiac conditions. So as I said before, interventions began during hospital stay, and the follow-up was from 1 month, 6 months until 24 months. So what did we realize? That there was a higher improvement in the intervention group at 1 month and 6 months. So people who underwent person-centered care interventions had higher general self-efficacy at these endpoints, 1 and 6 months. And it emerged also that specifically people with lower educational levels tend to show higher improvement when compared to people with higher educational levels. It was also reported a high improvement in the intervention groups at 24 months, although it was not significant as we got a P of 0.127. Regarding the cardiac self-efficacy, which is an outcome that is also composed by 3 dimensions: control of symptoms, maintaining function, or control of illness. We also, the review also identified that there is a higher improvement in self-efficacy in intervention group at 1 month. And when you look specifically to the dimensions, it was also found that higher improvement in the control of symptoms and maintaining function. No difference were reported at 6 months. So as I told you before, we included 2 of these studies in the meta-analysis, and they report only to the cardiac self-efficacy. As I told you in the descriptive analysis, we identified an increasing in the cardiac self-efficacy of the participants, although in both studies, but although the full meta-analysis only confirmed it in 1 of the studies. Nevertheless, the overall effect was in favor of the intervention group. So this review highlights that person-centered care interventions can lead to higher levels of self-efficacy in people experiencing acute coronary syndrome because it leads to a better control of symptoms, a better maintenance of the physical function, and that can lead to the hastening of self-management behaviors adjustments. And this is of major importance because we know the importance of cardiac rehabilitation programs in the recovery process. It's well known, although evidence tells us that the adherence to medical recommendations remains suboptimal, the same for lifestyle changes, and the follow-up is often fragmented. So, and this is partially due to the fact that self-management means not only that the person knows why and how to undertake certain behaviors, but that she is confident in the ability to carry them out. So we are talking about self-efficacy. So this really stands out an important role that person-centered care can have in a cardiac rehabilitation programs, and healthcare systems should adopt a more person-centered approach in this this recovery process. Regarding the more benefit that was found in the people with lower education backgrounds, this really connects to the fact that less educated people tend to have more difficulty in managing their health situations, to be less confident. So it really connects with this evidence. And the same way, the training for healthcare professionals is important to be considered because the quality of person-centered care is directly linked to how healthcare professionals value and implement person-centered care, person-centered principles in practice. This study has limitations that were identified. One important is related to the small number of studies. So, and this should be considered when interpreting the results, and the heterogeneity in the sample. Also, it's important to consider when generalizing the findings. So as a conclusion, we identified that person-centered care interventions appear to effectively enhance self-efficacy in individuals with after an acute coronary syndrome, that it seems to be sustained over time, particularly among individuals with lower education levels, and that previous training of person-centered care ethics should be considered. As implications for research, of course, the one really important is to expand the evidence. So to perform larger studies and in a more in this population, and also important to monitor the consistency of person-centeredness to make sure that it's exactly person-centered care that is being delivered. For practice, health policies should prioritize the implementation of person-centered care interventions from early stages and promote the involvement of people in their own care. So this is the references, and thank you for hearing me.
Thank you, Claudia. Thank you very much. And it's nice to see a very concrete example of a piece of work that's being done that is illustrating how important a person-centered approach to healthcare is. Did you have a specific question for the people in the room today, or would you just like to hear some comments?
No, I didn't prepare any questions. If the people have any questions regarding the presentation, I'm happy to answer.
Is there anyone with some burning questions or affirmations or challenges in the room? Or some thoughts? I know Tanya's just added something to the box, and she's willing to illustrate that, I think, with a hand.
Claudia, thank you so much. That was actually quite a different example that illustrates the earlier conversation we were talking around about person-centered interventions. So that is a lovely example. I'm interested that your 6 studies, 5 were from Sweden and 1 from Iran. Any thoughts on that?
Well, my first thought when I got these results was I was hoping to find more studies from different countries. And I think that this is aligned what you said in the beginning, that it's really needed more larger studies, more randomized controlled trials to really bring evidence that can support the implementation of health policies that can put into practice what we know that is true, but we need to put it into practice, and that's a difficulty that we talked here this morning. How do we put this into all systems? So yeah, that is my reflection, that it's really important to keep doing these studies, randomized controlled trials, to bring the evidence into practice.
And I suppose I'm interested as well, your outcome measure was self-efficacy. Whether in your literature searching, were there any other outcome measures that you chose to exclude?
No. I consider any type of self-efficacy, and these were the 2 types that emerged.
Okay, really good work. Well done.
Okay, thank you, Tanya, for your words.
Just to jump onto that, it was nice to see Bandura mentioned from my own master's study. And when I did my master's degree in nursing science, I used that theory as well, and with cardiothoracic surgery patients. The self-efficacy is nice, and maybe particularly interesting in today's healthcare environment, where, and I know that in the Netherlands there is a big movement at the moment to start looking about how can care be organised differently, and there's what they call the five foci, is what they say. It's about what can someone do themselves, what can technology mean to them, what can their those significant others in their life mean to them, the community in which they're living, and at the very last, is often what's said, at the very last moment in time, the professional. And that kind of feels in some ways very uncomfortable when you're looking at this from a person-centered perspective, the way this is presented, at the very last, the professional. And your study here brought my attention to the idea of focusing on what matters to the person, so listening to their narrative. And through listening to their narrative and focusing on what matters to the person, you may well be able to enhance their self-determination and their autonomy, and their belief in able to actually take control of their own health and their recovery. And that would be to the benefit of all. So it's kind of this is another way of looking at the way person-centeredness is interpreted, especially in the education of students and practitioners, the way that practitioners talk to students about what they're actually doing. This could be a nice study to get people, practitioners and students, thinking about, well, what does this mean when we're actually looking after patients in terms of enhancing their self-efficacy, because it can be done and it has a positive effect. So I don't know whether that's anything you'd like to comment on, Claudia, from your own reading, your own ideas.
Yeah, I think you said something really important that got me thinking, because this approach is really important in a perspective of the person, but also of the providers. And you said something there that got me thinking about the job satisfaction, because this is really important from the perspective of the nurse, of the physician that is delivering important care that matters for the person, and that is really dynamic. So, and it's really associated also with job satisfaction, implementing person-centered care interventions. So I think everyone has to gain here. We just need to understand and how can we really put this into practice. Yeah.
Are there any other thoughts in the room? No? I feel like one of those people with a hammer, and I'm going to go, gone. Speak now or forever hold your tongue. Okay. Well, we can also go to lunch. I know that people in Europe, probably their tummies are rumbling because we're an hour ahead of the UK. So we're kind of something to eat and something to drink. But before we do that, we'd just like to draw your attention to some other work that's starting to commence as for the community of practice, and for all of our members. And these are webinar dates. So webinars which will be set up with a specific intention of bringing to the forefront a focused topic area and engaging those present in some really good and in-depth discussions. The dates are here on the screen. The times will be initially 8 o'clock in the morning for Greenwich Mean Time for the UK, which will be 9 o'clock for us in mainland Europe, and for our partners in the Southern Hemisphere, or particularly in Sydney, so that's the time we'll be using from the Sydney perspective, will be 6 o'clock in the evening. So those will be for the first two, and as clocks turn, and I know it's very complicated with the northern and southern time differences, the times may change, but we will inform you as they do change, to enable everyone from the north and the south to be involved on the 18th of September, the 21st of November. So drop those down in your diary, reserve the time for an hour and a half, so you can engage, and the subject matter will be published in due course. And don't forget that as you go and fill your tummies with something nice, that there's also the Padlet. So I think Chris would really back me up in saying it's no good just thinking about it. It may be useful in jotting your ideas down, even if it is in a Padlet, because you also be sharing, and that could instigate someone else to start thinking differently or start thinking about stuff, and so enhance and instigate their own learning, so that you can not beneficial just for yourself, but it's also for the other members of the community. So please do take the opportunity to take your telephone, scan the QR code, and dive on in there and let all of those thoughts out of your head, through your fingertips, and into the wide, wide world. And I think that's the moment to kind of round us off. Claudia, we won't be saying goodbye to you for too long, because you'll be facilitating the introductions in the afternoon. So we'll look forward to hearing your voice again this afternoon, and thank you for doing that for us. Anything that anybody, my colleague, co-directors, would like to say before we go into lunch? Anything I may have forgotten with my grey hair and advancing age? Then I think it's time to throw that hammer down and say, it's going, the morning has gone. Enjoy your lunch, everyone, and we'll see you back in an hour and a half. Oh, check.